Hello, good afternoon everyone. Welcome to this webinar about the Clinician and Allied Health Professional-Led Research Grant. I would like to inform you that this webinar is being recorded. My name is Eva Watt. I'm the Training and Capacity Lead for Annual Support. Another thing that I would like to mention is that this webinar is not part of our training program. So we will be offering training and webinars. This is just a webinar to inform you about the grant and to give you the opportunity to ask lots of questions about this grant. So we will have time for all your questions, but before I introduce you to Catherine Street, our Director of Annual Support, I would like to let you know how you can participate in this webinar. So you will see a screen with a chat box on the left side. So you can share your questions in the chat box. And you can also talk today with us. So if you have a microphone, you put on the talk button when you want to ask a question, but you have to turn it off when you finish talking. And please raise your hand before you start talking so we can give everybody an opportunity to ask questions. Let's just do a quick test. Can everybody hear me? Can you please vote or chat or let me know? Yeah, I see a few people voting. So there is a voting tool there next to the raise your hand tool. So you can communicate with us by that as well. So I assume that people can hear us. If you have any issues, please call our technical support desk. And PowerPoint as well as the recordings will become available after this webinar. Okay, well, I will hand it over now to Catherine Street, the Director of Annual Support, and she will tell you all about this grant opportunity.
Hello everyone and welcome to this webinar regarding the Clinician and Allied Health Professional Grant opportunity run by Newfoundland Sport. Looking at the names of people who are participating, there's some that I recognise. So some of you will have heard the initial part of the presentation before, so you can tell me if I get it. Oh, I'm just going to stop 1 minute because I think somebody's just joined us on the line, on the telephone. Did someone just join on the phone?
I did, yes, but I'm not able to see the webinar, so I'm going to follow along with the PowerPoint.
Okay, and can I ask who is online on the phone?
Oh, sorry. This is Anne Warren.
Thanks, Anne. So we were just doing a quick introduction. I'm Catherine Street. I'm the Director of Newfoundland Support. And just to tell you what the agenda will be for today, I'm going to do a brief overview of the strategy for patient-oriented research, a very basic introduction to Newfoundland Support. Then I'm going to talk about the various funding opportunities that we run. And finally, we'll talk about the Clinician and Allied Health Professional-Led Grant. Oh, I'm forgetting how to move the slides. There we go. If anyone does have any questions during the presentation, please feel free to write them in the chat box. Eva is kindly monitoring that, so we should be able to answer those questions on the way. For questions on the telephone, please just interrupt and we'll make sure that we answer your questions as well. So first of all, what is the strategy for patient-oriented research? Well, this is an initiative which has been spearheaded by the Canadian Institute of Health Research. It's a nationwide initiative to enhance research across the whole of the country. What has been identified over the years is that although the CIHR had funded an incredible amount of excellent research, the actual impact on that at a health policy and practice level was not as great as people had hoped. So it was decided to bring in the Patient-Oriented Research Initiative, which is focused on improving outcomes for users of Canada's healthcare system. So it's hoped that by creating a culture of patient-oriented research, it will bring about real change at practice and policy level, so real impact for patients and their families. So when the Canadian Institute of Health Research brought in the Strategy for Patient-Oriented Research Initiative, I always think they set this up to confuse us initially, because there's two key initiatives under SPOR. The first one is the support units, of which, as I say, I'm the Administrative Director of the Newfoundland Support Unit. Brendan Barrett is the Scientific Director. And support units tend to be, are in general province-wide geographical units. So that could be province or territory-wide, apart from in the Maritimes, where the 3 Maritime provinces have come together to develop the Maritime Support Unit. And support units are responsible for developing local research support infrastructure to facilitate research, patient-oriented research. So that's making sure people and equipment and services are available, but also ensuring that patients are on board to join into the research and advise and assist with the research. And also we have a program, and all support units have a program for training and capacity development to ensure that support units and the culture of patient-oriented research is sustainable. The other initiative that CIHR brought in under the Strategy for Patient-Oriented Research are the National SPORE networks. Now these are described as being disease-focused research networks. But the first one you can see from the bullet point, primary healthcare isn't a disease, it's a service provision. So the first network that was developed is the primary and integrated healthcare networks. And they are all about enhancing primary care. They work across the country, though there is a focus on a network within each province. And of course, bearing in mind the Maritimes, which have one for the Maritime area. There is then also the mental health network, which is disease-focused, care group-focused, I should say, and that focuses on youth and young adult mental health issues. And finally, last year or late 2015, the CIHR announced 5 chronic disease networks. These are national in scope and cover gastrointestinal diseases, a network called Child Bright, which focuses on brain injuries for children, chronic kidney disease, chronic pain network, and diabetes. Now, within Newfoundland, the only one that has a clear focus within Newfoundland is the chronic kidney disease network, and Dr. Brendan Barrett is one of the principal investigators on that network. So prior to today's presentation, I know some of you had heard about the Strategy for Patient-Oriented Research, but for some of you this may be completely new. So patient-oriented research is just a new way of working, hopefully to bring about change at practice and policy level, and it's about putting patients first in the research infrastructure. So CIHR's definition of patient-oriented research is research that focuses on patient-identified priorities. So when we're talking about research to be carried out by the support units or by the networks, it's supposed to be addressing issues that patients themselves have identified. So patients should be involved in determining what the research should be looking at. Patients should also be engaged as partners within the research. So identifying the priorities, determining the methodology, analysis of results, dissemination of findings. And it should also focus on improving outcomes for patients. So as I say, putting patients first. So before I go on to patients as partners, I just want to clarify what the CIHR define as a patient. To me, I think the CIHR could have used the word public or citizen, because the CIHR say it's anyone who's been involved in health, had an interaction with health, family or carer of someone with an interaction with health, or may have an interaction with health, so really anybody. So when we talk about patients, please feel free to substitute whichever word you think may be more appropriate. Citizen, public, person. So back to patients as partners. I know a lot of you who may have worked in clinical trials before would have often worked with patients who are subjects, where we're studying the subject, seeing the impact of a specific drug that a patient is given, or a specific procedure that's done earlier for one patient than another. That is not what we're talking about. We're talking about working together with our patients and engaging them effectively in research. So in governance, we actually have patients sitting on our steering committee, we have patients sitting on research groups. In priority setting, we did a lot of work with members of the public to determine what priorities should be for Newfoundland and Labrador Support Unit. Conducting research, we have patients on research teams. And knowledge translation, we have patients who will assist us with disseminating information to the wider public. The idea of patient-oriented research isn't just one that's here within Canada. It's actually across the world, And there's a nice definition from Evolve, which is the UK organisation leading patient-oriented research. And they define it as research being carried out with or by members of the public, rather than to, about, or for them. So that's the background to patient-oriented research and the whole strategy developed by CIHR. So how are we taking it forward here within Newfoundland? Well, the Newfoundland Labrador Support Unit was set up in we got our funding in February 2014, and we opened for business in November 2014. We are co-funded by the Canadian Institute of Health Research and matched with 50 cent dollars through contributions from the Newfoundland Labrador government, the Department of Health and Community Services, and what was at the time Innovation Business and Rural Development, which has changed its name twice since then, to now Tourism, Culture, Innovation and Industry. We also have match funding from IBM, and I'll explain why IBM are involved in just a moment. Now, when we set up Newfoundland Support, we were actually developed under a broader umbrella of the Translational and Personalised Medicine Initiative. And that is a collaboration between the partners within NL Support, so IBM, Memorial and the government, but also the Centre for Health Information, the federal government through the Atlantic Canada Opportunities Agency, and other jurisdictional agencies with a stake in patient-oriented research. So that's things like regional health authorities, Newfoundland Labrador Centre for Applied Health Research. And we are lucky to be located in the new Craig Edwards Dobbin Genetic Research Centre. I really should put a proper picture of that there rather than the architect's drawings. So each support unit across the country is built on the same core functions, of which there are 6. The first one is data platforms and services. And the idea is that by having a data platforms and services core, it can facilitate and improve access to information and data, and also analyze that data. And that is really where the role of IBM comes in. As I said, IBM is a funder of the Newfoundland Support Unit and the wider TPMI initiative. And through this partnership, we have access to one of the fastest computers in Canada, and I believe it might be the fastest computer in Atlantic Canada. It certainly was when we got it. We also, through our partnership with IBM, have access to a huge amount of software, currently $21 million worth, through the academic initiative, so for free, and access to IBM staff to assist us in our analysis, and also to assist us in the second core, which is determining new methods for taking forward research. So the second core is method support and development, which then leads into the third core of applied health systems, KT, and implementation, which is all about taking the research and making it mean something, sharing the information with the public and colleagues, and also implementing change at real-world level for patients. Real-world clinical trials, the fourth core, is all about moving trials out of the randomized controlled trial done to very specific groups of patients who meet certain criteria into the real world. So clinical trials that can then be taken forward and scaled up to address issues for the whole of the province. The findings, that is, of course. The fifth core is career development and methods in health services research, and this is all about the work that EVA does in relation to training and capacity development. A number of you are involved in the certificate program and have attended a number of our webinars and workshops. It's also about training students. We have a funding stream for students, Masters and PhD, to support them in taking forward patient-oriented research. And finally, consultation and research services. The sixth core is all about supporting teams within the university, government, regional health authorities, anybody really who's interested in doing research focused on patient-oriented research. We're able to assist you with writing your applications, developing your methods, working out your budget. So anything really that you may need assistance when applying for grants. And central to all of those cores is patient engagement. Patient engagement is key to the work of Newfoundland Support. It's the other area for which EVA is responsible, and we have developed a patient advisory council and have a pool of patients who are able to become involved in research projects. As more people do more projects, so we may need to increase our pool. So how does it work? How can you get support from Newfoundland Support Unit? Well, the only requirements are the research must be patient-oriented, must include a focus on Newfoundland and Labrador. It can have a national or indeed international scope, but it must include a focus on Newfoundland and Labrador. And it should address the priorities that have been identified by our communities. However, if you just require a little bit of time from us, a few hours, just some advice, linking into a patient, identification of patient to join your team, then come and talk to us anyway, even if it doesn't address the specific priorities that were determined in our consultations with the communities. So before I move on to funding opportunities, can I just check, does anyone have any questions regarding the background to the strategy for patient-oriented research and Newfoundland support? No? I don't think anybody's typing. No questions from the phone? Can I just ask who's on the phone? The second person who buzzed in, the one who buzzed in a little bit later, can I ask who's on? Yeah.
I'm Marty Cohen with Special Practice Consultant for Occupational Therapy for Eastern Health.
Thank you. Okay, so if there is no questions regarding the background to Newfoundland support, I'll move on to the funding opportunities. As you can see, we have 4 funding opportunities listed there. The Patient-Oriented Research Grant, which is $75,000 per annum. We have $300,000 available per annum to fund either 4 grants of $75,000 or 5 if some are slightly less than $75,000, just up to a funding cap of $300,000. The expressions of interest for this actually closed in fall of 2016, so I'm afraid the opportunity to apply this year has passed. However, should the Newfoundland Support Unit receive another tranche of funding, we will be running this competition again. It will be launched in late summer, so please, we'll let people know, but please keep an eye out for that. We have the Clinician and Allied Health Professional Grant, the $10,000 rolling program, which I will go into more detail in a moment. That was launched in January. We have our education funding, the Masters and PhD. This funding call runs in spring and fall and is currently open at the moment until April the 14th. This allows students to access for master's studies up to $14,000 for 2 years, and for PhD studies up to $18,000 for 3 years. I should clarify, when I say 2 to 3 years, that length will be determined by whether or not NL Support gets additional funding. If our funding finishes in March 2019, then we would have to stop all master's and PhD funding at that point. We also have a patient-oriented research grant targeted specifically to support Indigenous communities. That is a $75,000 grant for a 1-year period. Again, we could fund one or a number up to a total of $75,000. That was launched in February 2017, and we actually had a webinar about that yesterday, which will be online if anybody is interested in that. So I must emphasize that to apply for that grant, the priority must be identified by the Indigenous community you are working with, and there must be a strong partnership with the Indigenous community. So moving on to the Clinician/Allied Health Professional-Led Research Grants. First of all, I'm going to apologize for the length of that title. We started off calling it just a Clinician-Led Research Grant, and then people said, but will everyone who works within health realize that it applies to them? So really, we are thinking about any professional who works within a healthcare delivery service. So that can be social workers, OTs, physios, nurses, pharmacists, doctors. So the reason we set this grant up is we had an external evaluation of the Newfoundland Support Unit at the end of 2016. It was our mid-term point, 2.5 years. And they identified that, yes, we have these other funding opportunities that run, but there's nothing to really kickstart or pilot research for those professionals who don't have it as their mainstay of their work. So it was recommended that we set this fund up, and we took that recommendation on board immediately. So it's a $10,000 in total grant for a 1-year duration, and the research must be completed within that 1 year, with the clock starting from when really your ethics approval is, if required, your ethics approval is released and the funding provided to you. Now, we've tried to make it fair because there isn't a specific deadline, and this is a rolling program. We've tried to split the grants up over a 15-month period. So we have 3 grants available of $10,000 each, actually now just until the end of March. So it ran from the beginning of February to the 31st of March 2017. We then have 10 grants available between 1st of April 2017 and the 31st of March 2018. So we will give out 5 by September the 30th, 2017, and a further 5 by the 31st of March 2018. Now, when you're thinking about applying for the funding, you really do need to refer to the funding eligibility of the Tri-Council. Because our funding comes from the Canadian Institute of Health Research, we can only fund projects or work that meet those funding eligibility criteria. Now, they are a huge long list, so I haven't tried to put them up. It's much better if you just refer to that guide. And then if you have any questions having referred to that, please just contact me. And as I mentioned, the funding will be released once the application has been approved and the ethics requirements have been met. So who can apply for one of these grants? Applicants can be clinicians, allied health professionals who work for a research, health or community care institution. That also includes private practitioners. As long as we can ensure that the private practitioner is licensed and that their application is not just transferring funding to a private practice for ongoing service delivery, but is actually looking at a research project, then that application is eligible to apply. So I think the main message with this is, as this is a new grant, if you are not sure, just contact me and ask who can apply. One thing I do need to point out at this point, though, is that the person who's nominated as the principal investigator cannot be paid from this grant. The co-applicant can be paid, but the principal investigator cannot. So please think about that when you're developing your grant. And also, I mean, $10,000 is a great amount of money, but it's not a huge amount of money over a year. So when you're taking forward your development, think about, I hate saying this, but think out of the box a little bit. Think about how you can develop a team. Think about the roles for students, how this could be used as a student development project, things like that. But again, if you've got questions, you're not sure, just phone us and ask. So the sorts of grants that we're looking for really came, the ideas really came from the evaluation, and they highlighted 3 areas that they thought we should bring these new grants in for. So that's quality improvement, so looking at improvement of services, evaluation of new services, and research into ways of doing things differently. So when you're thinking about your grant, bearing in mind this is patient-oriented research, think about what patients are telling you when they've been through your service, or when their family's been through your service. What are they saying that's good? What are they saying that's not quite so good? What do they think can be changed? They're the service user. They know a lot about that in the same way as you do. Also talk to your colleagues, not just your own professional, but the multidisciplinary team colleagues that you work with. How can they see services as being changed? And also, when you think about your own day-to-day work, what do you see as a challenge? How can you change to make life better, to make services better for patients? Oh, we seem to have Eva's just told me that we have a question, so Heidi. The principal investigator would be the person conducting the evaluation, and the money cannot be used to pay them. The principal investigator is the person who's leading the research. You could fund a research assistant to do what could be referred to as the legwork, or students to do the legwork. The principal investigator themselves cannot be paid, no. Okay, so developing your application. I mean, I'm sure that many of you on the phone and on the computer, on the webinar, sorry, have developed applications before. And I would like to refer you to the webinar that Dr. Debbie Gregory did on developing grants and grant applications, which is also online. It was done back in October time, Eva? Done back in October, so that will give you some more ideas around how to develop your application. But as I've already said, talk to people. Define the focus of your application. What's it you're looking to address? How will you bring about change? You've only got 3 pages of text, and that includes certain information that needs to be provided. So think carefully about how to define your question. Determine how you're going to measure it. What do you need to measure? How are you going to access that data? Who are you going to access the data from? What permissions do you need to access that data? Think about sharing your ideas with other people. Talk to others about how patients can contribute and shape the research. Other clinicians shape the research. And also think, what is going to be the value to healthcare? The outcomes of your research. What's it going to bring about? How's it going to bring about change? How is it going to improve value? I mean, we all know that Newfoundland and Labrador is in a very difficult financial situation, so anything that can bring value to healthcare and allow us to reinvest resources in healthcare is always welcome. So when you're writing your application, also think about what the assessment criteria are going to be. And just to explain that the applications will be assessed by the Translational and Personalised Medicine Initiative Executive, which are currently Dr. Betty Dix, myself, Dr. Brendan Barrett, and Dr. Pat Parsley. So we will be looking for patients as partners. The principal investigator's expertise and research contribution. I have to say this isn't going to be a hugely important criteria because we are looking to use this to help new researchers come on board and begin their work. But if you have done previous research and been involved in it, please make that clear. Looking at the real-world outcomes, what's the impact going to be? How are you going to improve care? How original is your question? Is this something that's been done before? Is this a brand new idea? Or is it a brand new way of looking at things? How the research will contribute to patient-oriented research? Whether it's scalable. It may be great that this research can bring about a change in, say, the emergency room in Carbonear, but is it scalable to the work of emergency rooms in St. Clair's and health sciences? Also think about its relevance to decision making. How will the information that you're developing or finding through your finding through your research project influence policymakers and decision making? So it's decision making at government level and also decision making within your own units or teams or health authorities. And as I've already said, we'll also be looking at the value to the healthcare system, or the potential value. So, the process to follow, there's no expression of interest, so we can't rule you out apart from the final stage. It's a single application that's only 3 pages, so make sure you concentrate on what you're doing. People sometimes say it's much easier to write a long application than a short application. I think that's actually very true. It's much harder to get things into a smaller amount of words. The application just needs to be submitted to me by email. The heading needs to explain that it is for the Clinician Allied Health Professional-Led Research Grant, what the title of the grant is, and the date it was submitted. Now, all of these details can be found on the Newfoundland Support website, and there's a specific link for the Clinician and Allied Health Professionals Grant. So any questions? We had the one question from Heidi early on, but any other questions? Heidi's typing. So we've got 2 questions coming. When would we find out if a grant is funded? Thanks, Michelle. It will be very shortly after you submit your application. So one thing I would say is, certainly for the March ones, please get your applications in as soon as possible. So Brendan, Pat, Betty and I meet every 4 weeks it's going to be. So as long as you get, the longest wait would be 5 weeks. We would then, of course, before we were able to release the funds, we would then, of course, have to make sure that you had gone through the appropriate ethics requirements. Hi, somebody just joined on the phone?
Yeah, this is Joni Cranston.
Oh, hi, Joni. Now, Joni and Karen, you've both just joined us, but unfortunately the main bulk of the presentation is over. We're on to questions now. But
okay.
The webinar has been recorded, and Eva, I believe that will be up in about 2-3 days. So we'll let people know as soon as it's online. Eva, is anything else?
We have a copy of the presentation.
You have a copy of the presentation, yeah. Is anybody else asking a question? Oh, here we go. Okay, Heidi's asked a question. With regard to patient-led, my program is a program for offenders living with mental illness. It may be more of a challenge for them to interview each other. Any suggestions regarding this? That is an interesting question. Eva, we're going to have, Eva, do you want to come round, or?
Yes, regarding patient engagement, we are really looking of patient engagement as partners, so not that they're just part of the interviews, but really helping maybe of how to do the interviews, what kind of questions to ask. I do realize that it is a challenge to engage and work with people who might have a mental illness. So I guess the best would be just to make an appointment with me and maybe one of my colleagues, and we can just work it out together. We have some great examples from the UK and other provinces, and we have also a mental health network here. So I'm sure we can find ways, but it is more challenging, and it may require a bit more preparation, a bit more out-of-the-box thinking, and so on. Feel free to drop me an email, and we can meet to discuss this.
Michelle, you've just sent in a question for apply now, and the funding is all gone for the end of March, so we need to reapply for the next round. What I would do is, if all the funding is gone, I would inform you of that and ask you if you want to be put through for the next round. So it would be a quick email back from me, Michelle, and we'd just confirm that you still wanted to go forward. So Heidi says, in response to Eva's reply, I'm not sure if my fellows would have capacity to be honest. That's an issue that I think you and Eva may have to talk about. As Eva says, there's some good examples from the UK, and also we do, through the Mental Health Network, have a lot of experience we can tap into in relation to working with mental health users. So we will do what we can to help you and see how we can work through. Okay, thank you, Heidi. Anybody else asking questions, Eva? Okay, before we finish, I did want to... Oh, Erin, where do we find the grant applications? Erin, it's on the Newfoundland Support website. If you look in the box on the left-hand side, I think it's the top one, it says Allied Healthcare Professionals Grant. And it's not really an application form, it's just the requirements of the what you need to put on your 3 sides. Okay, any other questions? I'll check again before we finish, but before I lose you all, I just want to give you an early warning of something that's coming out from the CIHR, which is all about rewarding success. And I thought maybe interesting to you as healthcare, I think most of you are healthcare practitioners, clinicians. The Canadian Institute of Health Research is bringing in a rewarding success initiative, which is all, the theory behind it is that by taking forward research within health services, we will be able to bring changes at practice or policy level which could result in funding being released from the healthcare system. The CIHR are looking for agreement from the local provincial governments to use some of that funding that is released from the healthcare system, to some of it to be reinvested back into the system, but some to be invested into further research. Now, I know a lot of you have worked in healthcare or research for a long time, will say it's very difficult to release money from the system, and I agree with you. But this is the model that CIHR are going for at the moment, and Newfoundland and Labrador have agreed to be a pilot province for this. So the first stages that will take place is Newfoundland and Labrador government will issue a list of what they see as the challenges that the healthcare system here in the province is facing. The CIHR will then look for research teams, individuals, to respond to that list of challenges with proposals, letters of intent, to outline how they feel they could research and address those challenges. And at the same time as responding to the list the government has provided, they will also ask healthcare professionals, providers, etc. within the province to identify what they see as challenges and how they would take forward a research program to address those challenges. So there's two areas there: addressing the challenges identified by the government, identifying challenges yourself, and the way you would address those. That list from the government, we believe, is coming out sometime in March, with the expressions of interest likely to be due back to CIHR in June. These are still very broad deadlines at the moment. When we know more, we will share more. Once all that information goes back to CIHR, it will be sifted, returned to government, and government will then identify their top choices, and those individuals will be invited to do a Dragon's Den to present their challenge and how they would address their challenge. From there, the winners of the Dragon's Den would go forward to business plan development, for which would be funding from CIHR, and then those that developed effective business plans would be able to go forward to apply for innovative clinical trials funding. So this really is very much an early warning. We don't have any full written directions from CIHR yet, but the support units are tasked with the job of facilitating this process. So as part of my role in facilitating it, I'm trying to get the information out to you as soon as possible, so you can keep an eye out for it, start thinking about it, let colleagues to know to keep an eye out as well. So, any questions on that? Oh, Christine's got a question. We're just waiting for people to type. Any questions on the phone regarding anything? Are we all good?
Okay.
All good. Christine, very interested in the Rewarding Success Initiative. As soon as the full guidelines are out from CIHR, we will post it on our website. We will share it to our normal communication channels. So Christine, we will check that you're on our circulations for things like our newsletter, and we will ensure that if you're not, that we make sure you put on it and that you get the information. Does anyone else have any other questions? As I say, as you're developing your applications for this grant, please, if you've got any issues, just give me a call and we'll do whatever we can to assist you in the application process. It's in our benefit as well as your benefit that the best applications come in, as we really are trying to develop that culture of patient-oriented research and making it a sustainable way of doing research. Okay, one more question from Christine. Have the CHR funding guidelines around working with patients and partners been released, i.e. reimbursements? I'm laughing because I had a meeting about this today. The draft, near final draft guidelines have been released. I'm just going to check with Eva. I think they're expecting the final guidelines out in May. The final guidelines from CHR will be coming out in May. However, I met with the Human Resources representative at MUN today to try and work out how we're going to implement the guidelines locally, and we have come up with a process, and we will be giving guidance on the reimbursement of patients who are working as partners. The levels of reimbursement will be based on the amount of time and input the patients are giving. I can't give any more detail than that yet because Eva and I have not sat down and worked out what those categories will be. What I can tell you though is that some patients may be treated as employees and receive pay, and others may receive a one-off payment for their work throughout the year. So Eva and I will be working on that in the next few weeks, and we will share that information with you, and we're hoping to discuss it in detail with the Patient Advisory Council at our meeting on May the 4th. Okay, I can't see anyone else typing, so I think I'm going to bring the session to a close. So I'd just like to say thank you to everybody for attending and for your interest in Newfoundland support. And I know I've said it about 5 times, but oh, sorry, Eva's reminded me that I need to tell you about one other education opportunity. Is this the last slide? It's not, yeah. We also have some other free education opportunities, which some of you are definitely signed up for. We have monthly webinars. I think we've only got 2 more to go this year. So we've got one on the 23rd of March, Big Data, Big Stories. Just go to Eventbrite to sign up for that. We've been running face-to-face workshops. We've just finished a pilot of the Patient-Oriented Research curriculum that CIHR had asked us to pilot. So we're giving you a bit of a break for a month or so. We will then be running some more workshops, and they will all be advertised on our website and through our newsletters. And most importantly, if you do want us to come and talk to your team, or if you want any advice, please contact either or myself. We do respond to one-off requests for sessions or consultations. And also, if you wish to go to any of our old training events, such as the webinar on grant writing, these are all available online under the Training tab on the Newfoundland Support website. And more information regarding Newfoundland Support and CIHR can be found on the 2 websites listed there. And please also follow us on Facebook and Twitter. We have a Choosing Wisely Newfoundland Labrador Twitter account and Facebook account. And we also have a Newfoundland Support Twitter and Facebook account. And we really do request that people assist us in sharing the messages and getting the information out there. The more friends you have on Facebook, the more people see important information regarding health. Okay, I'm going to look to Eva to make sure she's not going to surprise me with another slide. Okay, and once again, I'd just like to thank you all for attending, and any questions, just let us know. Thank you.